An extraordinary morning to wake up to for the 4.5 million people who are affected by the new lockdown across the north of the country. It came into force at midnight last night. If you happen to be enjoying the sunshine, having a bit of a barbecue in the garden, it was an incredibly warm evening last night across large swathes of northern England. If you're planning to meet your friends and family today, you're probably breaking the law. Separate households have been banned from meeting indoors for the time being. That's in homes, it's in pubs and in restaurants. You're still allowed to go to the pub, go to the restaurant, but you are not allowed to meet other households there. The support bubbles, though, can continue. This information, though, came out in drips and drabs for about 9 o'clock last night. Lots of criticism of the government, including from the Labour leader Keir Starmer, about the manner in which this information came out. We'll be talking to Matt Hancock, the Health Secretary, about that a little bit later in this hour. Joining me this morning is Darren Grimes, who's director at Reasons UK. Darren, the decision to bring in this limit on what people can do, second lockdown for large swathes of the north of the country, 4.5 million people, was taken at a meeting with the Health Secretary Matt Hancock at the Local Action Gold Committee. Their latest data showing an increased rate of transmission in those areas. Do you think people will understand the reasons for the lockdown, even if actually the method of passing the information out and announcing it leaves a lot to be desired?
Well, I mean, polling does suggest that people are supportive of the whack-a-mole strategy, really, but unless it actually happens to them, and then the polling switches quite dramatically. But listen, I mean, I think what we've got to make clear here is that we are in the middle of a pandemic, and if the cases are really spiking, and it is primarily down to large intergenerational gatherings that have the chance really to spread it even further, then I don't see what else the government could actually do here.
Yeah, I mean, that's the thing, isn't it? In terms of what are they supposed to do? Again, we're not seeing large spikes. We are, though, seeing a change in direction in terms of the infection rate. Well, let's talk about that now with my first guest in this hour, Dr. Simon Clarke. He's virology expert and microbiologist at University of Reading and joins us once again. Good morning to you, Simon.
Good morning, Julia.
Good morning. Now, a lot of people were saying, look, we're looking at very low levels of infection in the places that are affected. Let's go through them there. Greater Manchester, Blackburn with Darwin, Burnley, Henburn, Pendle, Rossendale, Bradford, Calderdale, Kirklees and Leicester also still affected by this specific rule, although as of Monday, the restrictions on pubs opening the like are going to be lifted. We're actually seeing, really very low levels of infection there, but we are seeing increasing infections at a low rate. That's the key concern. The direction of travel.
That's the key concern, absolutely. The direction of travel here is up, and I guess it's probably at a rate that sets alarm bells ringing with the health authorities, and that's why they've done what they've done. This is really quite a large scale. It's not a lockdown, it's a partial lockdown, but over 4 million people that are affected.
Yeah, indeed. I mean, people are still able to go out, go to the shops, go to the pub, live a lot of the normal life, just not have those family gatherings, which perhaps a lot of people would have been planning a weekend, good weather, and particularly, of course, the Eid celebrations for the large Muslim populations in many of those cities, towns and areas affected by this. Eid celebrations, of course, for those Muslim festivals, you can go to the mosque, but socially distanced. But obviously, usually you see a lot of large families, many 3-4 generations meeting in homes. That is going to be not just not advised, that is against the law right now in these areas. Do you think that's a good move?
Well, I think it tells us what we've known for some time, that a lot of transmission actually occurs in people's homes. So all the 1 metre or 2 metre distance and masks in supermarkets and stuff like that, that's all fairly marginal stuff. We've known for some time that most transmission occurs within people's homes. And if the government thinks that presents a problem and is going to drive up the infections for the rest of the society, they've simply got to do what they've done.
Obviously, there's going to be a lot of criticism of how they've announced this and why it was done so late at night. Why not a major press conference, and why sort of bitty information coming out at a time when most people wouldn't have been following it. But of course, this came on a day that the Office for National Statistics revealed that we had indeed seen with our excess mortality figures the worst death toll in Europe. That England far ahead, but even as the UK as a whole, the worst death toll, and Scotland actually just behind the UK as a whole. So even though different measures brought in those countries, two different constituent parts of the UK, remarkably similar when it comes to death toll. And the key thing here is looking at figures with excess mortality as opposed to different countries counting deaths in different ways, whether or not someone has had a coronavirus test, hasn't, and etc. But this is actually, the number of people that would normally die, between February and June in the country in a normal year, and the numbers that actually died this year, and we have done very badly. What do you put that down to? We're going to have inquiries into this for years to come, but what's your hunch on what is the reason why we've got that worst death toll?
I think it's probably down to a relatively late going into lockdown, and also the effect that we saw on care homes. Although other countries have had effects on their care homes as well, it just seems that ours were worse and particularly devastating.
Okay, thank you so much for joining us, Dr. Simon Clarke. Very much appreciate that. Let's talk to Councillor John Pennington. He's leader of the Conservative group at Bradford Council. Bradford, of course, one of the cities affected by this partial lockdown. Good morning to you.
Good morning to you.
Good morning. The reaction last night and this morning to this lockdown in your local area, what's it been?
Well, I don't think any of us should be surprised about this. We've, I think, about 1,000 new cases in just 1 week. We need to get a handle back on it. It's been a common talk from people, hasn't it? Maybe we might have to go back down into lockdown, and I think that is the case. People just have to be more responsible. This virus has not gone away. It's everywhere, but it's horribly invisible, and it's an invisible killer, and people kind of need to understand that. I think we've got, particularly the younger end of our society, just have the view that, it won't happen to us. It's almost a bit of a lark. Well, until we know somebody who dies from the virus, this message isn't going to hit home. This is serious. Well,
indeed, but of course we do know that actually, it doesn't seriously happen by and large to young people. Unfortunately, though, they are able to carry the virus to other people. You're saying there's 1,000 new cases in Bradford in just a week. That's going to be cause of concern. Now, in terms of these measures, the way in which they were announced on social media, on Twitter, after 9 o'clock at night, less than 3 hours before they actually came into force. Do you think that is a good way for the government to communicate vital, life-saving information to the people of your town and city?
Well, look, it's a moving tide, isn't it? Any way, on any method they can get the message out, they need to do that. You see, in Bradford's case, we have an awful lot of, shall we say, very close-knit communities, many of which are Asian. Who seem unfortunately susceptible to COVID. And in some of the houses in our district, we've got 3 generations in one house, even in a terrace house. It's sort of still a family tradition for them all to live together. But we need to get the message into those homes and get something done about it.
Well, a poll yesterday suggested that back in the early stages of proper lockdown, when we genuinely were confined to our homes, 90% of people understood the rules. Now it's only 45% understand them broadly, just 14% understand them fully. I'm wondering if it's going to be even lower than that in Bradford and Greater Manchester and Burnley and everywhere else as a result of these new lockdown rules. But you mentioned the fact that the large Asian population in Bradford, and we know in many of these areas that are affected by this local lockdown, they are larger Asian populations. This is going to affect particularly those who are Muslim, heading into the Eid celebrations and festivals today. Lots of families wanting to meet up. Is it your understanding that it was the prospect of families meeting up in homes for Eid that actually prompted this being brought in at midnight last night?
I think some of the examples we've had around the country where people have been so irresponsible with these public gatherings, I think that's highlighted the issue. But the Eid celebrations are over this weekend. They're the religious celebrations, and part of Eid is the fact that it's a sacrifice. So part of that sacrifice is looking after other people. But the big problem we've got is policing the issue, because if you've got a large number of people, family members, in one home, and you don't want them all together, quite frankly, where do they go? Well, they go down the road and then they go to some friend's house, and that increases the number there.
Yeah, I mean, that is the problem. Has there been an issue in terms of the communication of what the rules are to Asian communities in your area? There's been a lot of talk that ethnic minorities are definitely being hit harder by the virus, a higher rate of death, and there may be lots of other demographic and health reasons for that. But also there's a concern, there's been an issue in Leicester, it's been talked about by local MPs there, that actually a lot of communication simply hasn't gone out. A lot of people in the local areas don't actually speak English as a first language. They're not seeing this communication. They're not watching the sort of national mainstream media, and they simply don't know the rules, let alone choosing to abide by them when they do. Has that been a concern for you in Bradford?
Yeah, I think you've hit the nail on the head there. You mentioned a lot of people don't speak English. That is still the case, particularly with the elderly. They rely on information from the young. The demographics you highlighted, you're quite right to do that. And I mentioned earlier on about some of the young not being irresponsible, but how can I phrase it in any other way? Are they passing the message through to the generation above? They need to.
So you're saying we've got large swathes of the population who are just going around their normal business, not social distancing, not obeying the rules of lockdown that we're supposed to all be obeying, and they themselves are putting their own families and community members at risk. Is there any reason to think that they're going to be more likely to obey these new rules that came into force at midnight?
Well, as I started, my first comment was until they know somebody who's died from the virus, this message isn't going to hit home 110%, and it needs to do.
OK, Councillor John Pennington, leader of the Conservative group at Bradford Council, thank you very much for that. Let's just briefly bring in Darren Grimes. What's your reaction to what John Pennington had to say, Darren?
Well, listen, I think I was really struck by what he said about the policing of this thing, actually, because if people just aren't aware of it, how are they actually going to enforce it? How are they going to make sure that people adhere to these new rules? I don't really think you can. And with a lot of Tory MPs coming forward this morning, Julia, and saying, well, hang on, this blanket ban actually reaches, it might be local areas, but it's reaching areas which actually don't have any significant uptick in cases. And they're saying, MPs like Sir Graham Brady and William Bragg are saying, well, it's not right to treat all 10 boroughs the same. You know, this isn't the right approach. So I don't actually know how they're going to enforce this, Julia. So that'll be interesting to hear from the Health Secretary when you speak to him later on.
Well, let's talk about that right now with Health Secretary Matt Hancock. Good morning to you.
Good morning.
Good morning. OK, tell us first why you felt it was necessary to ban households from meeting with each other indoors, anywhere, in homes, pubs, restaurants, anywhere at all, as of midnight last night in these parts of the country.
Well, Julia, we've been tracking what's been happening across the country, and
we've got a few problems with that phone line, as you can hear. Mr. Hancock,
hear
just one second. You just cut out for a moment, but if we could try again, that'd be very grateful.
So we've been tracking the virus across the country, and the thing that we've discovered is that particularly in these areas, the transmission, the number of people who are catching the virus from meeting people in their own home, meeting friends and relatives, is higher, and unfortunately the number of cases is going up. And so we needed to take this action. We made it as targeted as possible. I appreciate it's across large parts of northern England, but we made it targeted on this because this is where the evidence shows that the virus is spreading from households getting together. And you know, it's one of the things that we love to do, and people understandably, you know, it's this sort of social contact that makes life worth living, but unfortunately it's also what the virus thrives off.
Okay, when did you first become aware that there was this issue and that you were seeing a rising trend in infections? Because a lot of criticism, not necessarily of the decision to introduce this lockdown, but to do it in a tweet at about 9:15 on a Thursday night, just hours before it came into force at midnight.
Well, I don't think there's been... I think people understand that we have to move rapidly.
So how soon between you knowing that there was a problem and you actually announcing this? What was the time frame?
Well, we track this information all the time, and we've been working with the local authorities to try to control this in a more local way for several weeks now. But it became clear that this wasn't working, and we needed to take action. And we do sometimes, I'm afraid, have to take rapid action, and I think people understand that.
I don't know. I think people do understand that. But I'm asking.
Yeah.
I mean, you chaired a meeting yesterday with the local Action Gold Committee, looking at the latest data showing this increasing rate of transmission. So, although still low compared with what we've seen in recent months, the direction of travel is concerning. I think people understand that. You're acting quickly. But what time did you finish that meeting, having agreed you were going to have to introduce this local lockdown? And how many hours was that before you actually announced it on Twitter at 9:15 at night?
Well, as a matter of fact, I made it clear in a public statement that I gave, and of course we communicate using all the modern tools. So what matters is how do you get the message as quickly as possible to the people affected.
Okay.
We took the decision during the day. We had a series of discussions about it. I spoke to Andy Burnham, the mayor of Greater Manchester, and we've been working with the local councils as well to make sure that we take the action. So
so wait a minute. The formal
meeting was in the afternoon. And then we took the decision and made it public as quickly as possible. But I think the thing is, Julia, people appreciate that we sometimes need to move fast in response to this virus.
I think people saying in this case not fast enough in terms of getting the announcement out there. People wouldn't have seen the announcement last night. People have got lives, spending their time with their families. They'll wake up today and simply won't know the rules. But it's been quite a lot of criticism. One criticism from Marie Lecomte saying, if anything, I'd say the rules on the new localised lockdown are a bit too clear. Next time, Matt Hancock should slip the announcement in 5 chocolate bars across different newsagents in the town he wants to lock up. I mean, there is a lot of confusion. We already know, a poll yesterday, that only 45% of people are understanding current lockdown rules and only 14% have a full understanding of exactly what they are. This is going to make it even harder for people, isn't it?
Well, no, because the rules in Greater Manchester, in East Lancashire, and in the West Yorkshire, other than outside of Leeds, are really clear, which is that people can't congregate in other people's homes or gardens, and shouldn't go to they can go to the pub, to hospitality, but shouldn't do that with members of with people from other households. It's really clear. I'm really glad that the vast majority of people not only understand but are following the social distancing rules. And what we've seen throughout the crisis is people following the rules when we set them out. And that's we move fast, and we have to sometimes. That's the nature of the virus. And then we're as clear as we possibly can be with the communications, and that's exactly what's happened this time.
Is there a big elephant in the room that people are tiptoeing around and needs to actually be said out loud? That we're looking at, we had that extra lockdown in Leicester, we've seen problems in Luton, we're seeing it in Bradford. Large numbers, a lot of the areas that you're talking about, which are being affected by this, the 4.5 million people, have large Asian populations. Now we're entering, Eid celebrations today. Many Muslim families, people wanting to meet up today. Big concerns about 3 generational families living together, large extended families meeting up in homes where there's a high risk of transmission. Is it the case that you are particularly concerned about Eid festival celebrations today, and that was why it had to be brought in so soon? Is there also a particular concern that certain communities, particularly Asian communities around the country, are not obeying the lockdown or are more affected by the virus because they often do live in larger 3-generational families where there are more people are at risk in any one household? Isn't this something that we need to address, and we need to address in plain English? And also a concern that there are many communities where English isn't a first language. They're not watching mainstream media. People simply aren't aware of and not obeying the lockdown rules at all.
Well, we are putting a lot of communications in all the languages that people live their lives in, and that is a really important part of making sure we get the message across. And my heart goes out to the Muslim community because with Eid celebrations this evening, clearly this is going to have a very big impact on those affected. And we've been working with the imams and with the other religious leaders across the country to have COVID secure ways of celebrating Eid this evening, but unfortunately, people are not going to be able to households are not going to be able to meet indoors. But we have left the exemption because we know outdoors is much safer. We have left the exemption that two households can meet in a public outdoor space like a park, so long as they're socially distanced. And that rule's there for all of us.
But exactly, and these rules do affect all of us, and they're about keeping us all safe. But we do know that people in ethnic minorities have been at higher risk of dying of this disease. We don't know whether it's demographics, socioeconomic reasons, the jobs they do, health risks of diabetes, from et cetera, et cetera. Is it a simple coincidence that the places that have been named to be that affected by this extra lockdown have large Asian populations? Is that a coincidence? Or is there a particular issue where some populations in this country have not been, for whatever reason, obeying the lockdown enough to keep themselves and everyone else safe?
Yeah, well, it is. Look, I think the way I'd put it is this, that the virus spreads from human to human, no matter what community you're from, and it spreads when people are close, and so everybody needs to follow the rules, which are there for good reason. And we've got it, and so it doesn't, whatever language you speak, we've got to get the message to people that social distancing is incredibly important. To slow the spread of the virus.
You're tiptoeing around this. The tiptoeing around, I know people are doing it for politically correct reasons and for good reasons. But this is about saving people's lives. If it is the case, and I don't know whether it's the case, I'm not the health secretary, I'm not an expert in this, I'm simply asking the questions. If it is the case that there are certain communities in this country who are not obeying the lockdown for whatever reason, whether they don't know about the lockdown rules because of language issues, whether they're living in sort of parallel communities, whatever the reason is, they're having to live in 3 generational households due to sort of just demographic circumstances. Do we not have a duty of care to speak in plain English and say, look, some people are not obeying the lockdown. You in particular need to obey the lockdown. You're putting yourself and your families at risk.
Yeah, well, it's the thing is, it's not quite as simple as that, because there are different groups who are adversely affected, and we've got to make sure we communicate well with all of them in the way that they receive the message, if you see what I mean. It's no good just me saying it, it's how people hear it. But it's not just about ethnic minority communities. For instance, we've seen a significant problem with migrant workers from Eastern Europe who work in food factories or in agriculture, food picking. So it isn't as simple as the way that you put it, but it is what I will say is it is really important that we get the message out to everybody, and it is harder to get some of those communications across, which means we need to work harder to get the messages across from people who are trusted in languages that people live their lives.
I've got to say, I'm just having had the conversation with the Health Secretary, Matt Hancock. It is time for everyone to do a little bit more plain speaking during this pandemic about who and who is not obeying the lockdown. First, we had those Black Lives Matter protests, and everyone said, well, if people feel strongly about going on a protest, then it's okay to breach the lockdown rules. Not okay for someone else to breach the lockdown rules themselves if it wasn't for a good reason, apparently. But people get to pick and choose. The reality is we are seeing 4.5 million people now affected, far more than those affected in Leicester when they went back into lockdown, as the rest of us saw restrictions lifted on the 4th of July. 4.5 million people across Greater Manchester, Blackburn, Burnley, Bradford and elsewhere being affected by a lockdown that affects them, their ability to see family and friends, no one to meet up with another household in their home or anywhere else indoors, in pubs, restaurants or elsewhere. Why? Well, because there's been a spike in cases in the local areas. Why? Because people haven't been obeying lockdown. Largely, we know it's been young people over the last few months who've been ignoring lockdown, not worried about themselves because, hey, they're not likely to die of the pandemic. And they're quite right about that. However, they are able to pass the disease on to others. And of course, we know in areas with large Asian populations, as all of these towns and cities on the list of the new lockdown restrictions have, they are often living in 3 multi-generational households, living very closely by, and therefore, as we saw in Leicester, far more likely likely to pass the virus to older relatives and to other family members. Eid starts today, a Muslim festival where many families will want to meet up and share the celebrations with each other. That is now going to have to stop. But this is about saving lives. Isn't it time that our politicians actually said it as it is? Large numbers of people in different communities across this country are not obeying the same rules that should apply to all of us. They are putting themselves and other people at risk. We need to say it out loud and we need to say it clearly. We do not have separate parallel communities in this country allowed to obey different laws as of their own choosing. We all need to be in this together, and that involves us all obeying the laws together. And it's about time that politicians were open and honest about this. And yes, the excuse that you don't speak English as a second language doesn't really fly. Well, as a first language, you should be able to communicate and understand what the government is telling you in this country, if you live in this country. Just if I was in Spain, I'd need to know enough Spanish to be able to understand the rules in Spain. We need to be open and honest about what we need to do to keep this population safe. I don't care what religion, what ethnicity anyone is. We want everyone in this country to stay safe. But that involves all of us obeying all of the rules. 8:11 is the time. Darren Grimes, we'll get your thoughts in just a few moments on all of that. Right now, though, let's talk to Lucy Powell. She's Shadow Business and Consumer Affairs Minister, but she's also Labour MP for Manchester Central. Good morning to you, Lucy.
Good morning.
Let's talk, first of all, if we can, about this local lockdown affecting, of course, your constituents across the board, not able to meet this weekend, and who knows for how many days, weeks ahead, with other households indoors at all. Do you welcome those restrictions? Do you think they are government's right to bring those in?
Well, look, I support anything that will keep this virus under control and save lives. But I do have some serious concerns about how this decision has been taken and how it's been communicated, because what is really important here is that we have transparency so that everybody understands why decisions are being taken, so that they then are more likely to adhere to them, that then we have clear actions that follow, so everybody knows what's expected of them. And there are many questions that I've been inundated with overnight, which I'm unable to answer. And people need to feel that things are proportionate and fair. And I'm not sure that we've met those criteria with this today. I mean, I was quite blindsided by it because I follow the data very, very closely. I was on a briefing call. There was a briefing call yesterday for members of Parliament yesterday morning. There was no sense whatsoever that this was imminent or necessary. And then, we get this announcement very late at night for new measures coming in at midnight, and no one's really around to answer the questions.
Did you find out on Twitter as well? We know Andy Burnham, the Greater Manchester Mayor, was at a meeting earlier in the day with Matt Hancock. He spoke to him earlier in the day, as the Health Secretary's just told us, but they didn't bother informing local MPs.
No, I found out like everybody else.
Quite extraordinary.
It is, and it's frankly not good enough. And it, as you said, it does cover a large number of people. I think my understanding is that this was a precautionary step. It was supposed to be quite a modest step about discouraging people from going into other households and gathering in other households. But then as the guidance has emerged, that the guidance has been more widespread than that and more strict than that, and covering lots of areas. And as I say, I've been inundated with calls around, what does this mean for people going on holiday? What does it mean for planned weddings this weekend that were allowed, visiting elderly relatives elsewhere outside the area, returning to the office that people have been encouraged. I mean, just hundreds of questions that I think, are still unable to be answered. And I think, if we had a very world-beating, as we were promised, track and trace system, we would have a much clearer idea of exactly where and how transmission is occurring, and we could be much more localised in the action that followed.
Yeah, but the thing is, we do have a darn good idea of where transmission is happening. We know it's happening in homes, and we know it's happening where people are not obeying the lockdown rules. As I've just been saying in my opener, and as I've been talking about with Matt Hancock, the Health Secretary, do we need to be a little bit more open and give express instructions and appeals to particularly the Asian populations who are specifically at risk because of often living in these multi-generation households? So it means, young people might well go out and about and live their life freely and break the rules, but aren't at risk themselves. themselves, but if they're not seeing elderly grandparents in the next few weeks, then perhaps they're not putting them at risk. But if they're living in a home with elderly grandparents, they are putting those people at risk. And there are large extended families meeting up regularly, particularly, of course, with Eid today. We are talking about a massive risk for a large proportion of the population here. Should we not be a little bit more honest about this and make sure that that information is getting to the people who need it most?
Well, I think we do, and I think that's why I say transparency. I mean, I don't know the data, so I can't pinpoint for you where and how that is happening. So we really do need much more transparency about that data, in real time, so that people can understand where things are happening and why. So 2 or 3 weeks ago, it was sort of clearer that certain workplaces were the root cause of some transmissions.
Certain workplaces, sweatshops being run by local business people, involving an awful lot of people being exploited, the local Asian population. But again, everyone keeps saying
not just that. I mean, there were food processing plants in Anglesey.
Yeah.
I mean, there were certain confined workspaces, yes, where social distancing wasn't being adhered to, clearly. But as I say, I knew there was an issue in Oldham that's been well known for some time. There was a briefing call yesterday. This was not flagged. So I can't be sure about that. What I do know is that there are more sort of young people seem to be getting it. So we've got to have transparency so people understand, and then they're more likely to comply if those messages are clear, understood, shared by everybody, so that we're all out on the radio saying the same thing for the same reasons with clear instructions that then people can follow, and then you get compliance. I think when you have this sort of confusion, you don't get it.
Okay, well, let's also talk about what your party leader, Keir Starmer, who has been very critical of these measures last night on Twitter, he's doing today. He's officially launching what your party is calling the Jobs, Jobs, Job campaign today on a visit to a company in Peterborough. What is this campaign? Well, apart from the obvious, what is this campaign aiming to do?
Well, look, I mean, as we've just been talking about, when new restrictions come into place, or some of the existing restrictions are still in place, this can have a devastating impact on people's livelihoods and jobs and businesses. We've got the furlough scheme tomorrow now starting to be wound down. So employers are having to start to contribute to the furlough scheme from tomorrow. And we know that nearly 1 in 5 people who were originally furloughed are still on furlough. So that's nearly 2 million workers. And the estimates of the levels of unemployment by the end of the year, if we don't see further action to save jobs, could be as high as 10 or 12% of the population. These are unprecedented levels of unemployment. So we're calling on the government to do more now to save the jobs of today now. We need more flexibility and an extension of the furlough scheme, especially for certain sectors adversely affected, or for areas that are seeing new restrictions like we've seen here in Greater Manchester overnight. And we need some more sector-specific support for those industries most acutely affected. Frankly, for restaurants in Manchester waking up this morning to hundreds of phone calls of cancellations, the meal deal offer that starts on Monday is going to be no good whatsoever. So we need more sector-specific support to save these jobs.
Lisa Powell, thank you very much indeed. Labour MP for Manchester Central, Shadow Business and Consumer Affairs Minister. Just a brief word from Darren Grimes. Apologies, Darren, we haven't had much chance to hear from you in the last half hour with the Health Secretary and Shadow Business Minister there. Your reaction to the announcement late last night that we were going to be seeing this lockdown affecting, 4.5 million people not able to meet indoors with any family or friends?
Well, listen, Julia, I think what you said in that interview was when eventually you'd managed to get out of Matt Hancock, that and address that issue, tackle it head on, that some ethnic minority groups and migrants from Eastern Europe that speak precious little English are failing to grasp the rules of lockdown. That's a really serious issue, as you rightly said, and we have got a duty of care to ensure that people are following these rules. But how can you do that if they're not integrated into wider society to the extent where they're not speaking English? Surely we've got a duty of care here to make sure that people are speaking English, because that's the problem. Government can communicate until their heart's content, but how the hell are we supposed to get this message across if they can't speak English?
Absolutely. Thank you very much. Let's talk to the leader of Burnley Council, councillor Charlie Briggs, about this extraordinary announcement late last night from the government that there would be a lockdown as of midnight last night across large swathes of northern England, including Burnley. 4.5 million people in total affected, separate households banned from meeting indoors, whether it's in homes, pubs or restaurants, but still an awful lot of confusion about what people can and can't do. Charlie Briggs, thanks for joining us.
You're welcome, and thank you.
Thank you. So when did you first hear about this?
At 10:15 last night.
That's around the time I heard as well, about half an hour after the announcement came out. So no contact during the day. Did you have any idea that there was a problem and that we were seeing this spike in infections that apparently the Health Secretary at Hancock knew about at a meeting earlier in the day?
No, nothing at all. I was in a full council meeting between 6:30 and about 9:25, and then I got a text through about 10 minutes later from Luckman, who is a part of my CEO team,
yep.
and then we spoke to Angie, the CEO at Lancashire County Council,
yep.
and she gave us a little bit of information, not a great deal. She said that the meeting down London is still going on, and we have not heard of what they're planning on doing.
But you were not aware, as the leader of the council of a town that's now being put back into sort of some partial measures of lockdown. You were not aware of a spike in cases or concern about that spike. How bad has the problem been?
Well, the week before we did have a meeting with a few councils because right at that particular time, Blackburn was going into lockdown and they were going to lock down parts of Pendle, I think it were, and they want at that particular part of the week they were going to open the leisure centres up and the beauty salons and things like that, and they wanted to shut them down again. So we had a look in Burnley. We had a look on our system, and we were what they call green. Ours hadn't spiked. So we were okay. It was Pendle and Blackburn which was spiking. Now, I got informed late last night that we have got a few more numbers of the virus in Burnley. So maybe that was the information they had down in London, which I didn't have.
Yeah, I mean, that's the worry, is that local people aren't getting that information. Just finally, how confident are you that local people are going to obey these measures and not meet up in households? Today, hottest day of the year. I mean, hopefully, of course, people will be outdoors on a day like this, but over the next few weeks.
Yeah, I'm hoping that a lot of people will be outdoors today, and I really, really do hope that they all obey what's been going on, because public health is paramount. And we need to get rid of this virus. I know it's going to be an ongoing situation for a long, long time. I know it's not going to go overnight, but I think I do believe the people of Burnley are very civil and they do understand things. And I think we will go down the route that everybody will be safe.
OK, thank you very much, Councillor Charlie Briggs, leader of Burnley Council. Just bringing in Darren Grimes on this. It is extraordinary, is it not, that local elected leaders of these areas again and again are simply not being told. We've got a local MP in Manchester, the leader of Burnley Council, not being given any information about the prospect of these new measures or about the rise in cases.
Well, exactly. I mean, to be honest with you, as we said earlier, it's communication. It comes down to communication, right? And the government isn't being very good at that at the minute. And communication, full stop. That's the problem that we've got here as far as actually being able to communicate to communities and say, these are the rules of lockdown. This is what you must adhere to, because people just don't understand what's being asked of them.
Let's talk to Dr. David Nabarro, who's Special Envoy on COVID-19 to the World Health Organization, and joins us once again. Good morning to you.
Good morning,
Good
Julia.
morning.
Good to be with you again.
We'd love you to speak to you again. Is this the right decision by the government?
When you've got these new spikes of disease occurring, you have to act quickly. You have to be robust. You have to nip them in the bud. And the evidence, as far as I can understand, suggested that transmission was increasing in these locations, and that's led to the actions that have been announced. I prefer not to use the term lockdown.
Yeah.
I prefer to say it's movement restriction, enhancement of physical distancing, and of course linked to this is the encouragement always to wear masks and absolutely to stay away from others if you have symptoms of disease. It's really important, Julia, because it's acting quickly and robustly now that can stop a really big spike in cases and therefore deaths in the coming weeks. So, yes, I suspect not only was it the right decision, I suspect it's been very carefully thought through in terms of where the numbers are.
Okay, and again, we don't actually have to see large numbers. It's really a change in direction of travel, isn't it? That's the key issue, and we have seen that increase. And also, 846 new infections reported yesterday across the UK. That's the highest for a month. Now, there are a lot of experts saying, look, we're not going to get a second wave. This isn't technically speaking a second wave, and you and I discussed earlier in the week. This is really a continuation. Someone was saying of the first wave. These are the sort of spikes we would probably be expecting. A lot of people, though, if you could explain to them, are very confused. Well, how come how come I can still go to Primark? Some people are saying I can still go to the pub, but I can't meet with someone in my home or meet with friends and family in the pub. Can you explain why certain things are far more risky than others?
Thanks. Again, I'm going to now sort of do what I can possibly do, despite the fact I don't have all the evidence in front of me. But all over the world, we're seeing that as these spikes appear, it tends to be close family members where the greatest transmission occurs. And it tends to be in gatherings when families come together. So I suspect that that's why this particular instruction has been given. I'd like to say to everybody that it's not the present numbers now that really we should focus on. It's the trend, because actions taken now will determine what happens to those numbers in a week or 10 days' time. And that's why we mustn't base any criticism of decisions on the numbers that we have today. We must base it on an analysis of the trends. And that's why I suspect that this was very carefully thought through. And I really do think, Julia, that this seems like the right thing to be doing, given the way in which the numbers have been going.
Okay, Dr. David Nabarro, really appreciate that. Thank you very much indeed. Well, joining us now is one of the few people who heard about this in advance before about 9 o'clock last night. That's the Mayor of Greater Manchester, Andy Burnham, who kindly joins us now. Good morning to you.
Good morning, Julia.
Good morning. We spoke to the Health Secretary, Matt Hancock, a little bit earlier in the show. He said he had spoken to you earlier in the day. When were you first aware that we were going to look at these further restrictions and social distancing for people across the north of England?
It was about 4 o'clock yesterday afternoon when the Health Secretary called me. But to be honest, Julia, we'd seen the data ourselves the day before. So I'd been one of those people arguing for more data over recent weeks, and the government finally had given us that. So I could see the same thing that they could see. And what I could see was rises in 9 out of the 10 Greater Manchester boroughs over the space of a few days. And it was that general spread of the virus that made me conclude, and of course the government conclude, that something was needed to stop, to reverse that trend.
And that rise in the number of infections that were positive, that was happening only in recent days? It's not been a very slow rise, it's just been very recently?
Yeah, that's the thing that really jumps out from this. So this time last week, I got data for all 10 Greater Manchester boroughs. 9 out of 10 had a falling rate of cases. Today, that picture is completely reversed. 9 out of 10 have a rising rate of cases. And I think this is what people need to bear in mind when they're thinking about, well, why is this being announced late on a Thursday night? And it's all confusing. And I do understand that, by the way. But the virus can change so quickly in a heartbeat. You can see a rise that takes off. And I'm afraid that's what we've seen in some of our boroughs in the last few days. Hence the need for decisive action.
OK, now you've seen it across the board, you're saying in Manchester, but a lot of people are pointing out that in many of the other cities and towns that are affected, it's the increase has largely been, and we've seen this in Leicester as well, and again also in Bradford, in Blackburn, where we had more restrictions last Friday. A lot of this is in the Southeast Asian communities who are living often in much more cramped conditions, crowded conditions, often 3 generations in a household. That's very typically the norm, far more so in ethnic minority households than white households in this country. Is it your concern that we have in the messaging about the lockdown and how people should be behaving and social distancing, hand washing and masking, that the full message has not got through to every community in the same way?
I think there is an issue with people getting fatigue, I think, isn't there, from the whole situation? And I understand that. Everyone understands that. And certainly there has been an issue with parts of the Asian community around spread of the virus in the type of housing, Julia, that you describe. And this time last week, we had isolated hotspots in some of those communities in Rochdale particularly, but in Oldham as well. The change this week is we've seen rises in other communities. So Altrincham, a very different community in the south of Greater Manchester. And I think that is the kind of change on the ground that has led to this move by the government today. So, yeah, I think it's tough for everybody, isn't it? But perhaps a feeling had started to get established that this was over, we kind of could return to normal. I don't think we've fully woken up in this country yet to the reality of living with COVID. This is going to change our lives for, I would say, the next year. We're not the first to have measures like this, Julia. We will not be the last. This is going to become, I think, a regular occurrence and something we're going to have to get used to.
And do you applaud the government for taking this decision? There's quite a lot of criticism of how it was announced, 9:15 on Twitter, messages coming into force at midnight. A lot of people would have woken up this morning completely unaware of the new rules with their plans, particularly Muslim families planning to celebrate Eid today with their family members at home or in communal places, but no longer allowed to do so other than at the mosque under social distancing rules. Other than the actual messaging of that, do you actually welcome decision? Do you think this was a decision taken at the right time and at the right level?
Well, throughout this crisis, Julia, I've been on your programme calling for a strong public health approach. So yes, when presented with evidence of widespread transmission, decisive action is required. And I supported the Health Secretary on that basis. I do have concerns about the announcement being made and the detail not being provided until very late last night. And I think that is something the government needs to correct. Because when you make an announcement like this that affects millions of people's lives, you do have to give them specific answers to the questions that they have. But let's leave that to one side. There's no point me coming on and sort of pretending that I'm nitpicking with the government's announcement. I support what they're saying today.
And just finally,
I would ask people to follow it.
Just finally, how long do you think people are going to have to be facing these rules?
Well, I don't think that this need be something that is in place for a long time. So,
couple of weeks?
Yeah, well, I don't know. I mean, obviously, it's dangerous to make those kind of predictions. But, I was describing to you a moment ago, Julia, how quickly the position changed from what we had last week to what we've got this week. So, equally, it could change very quickly the other way again if people follow the rules. And I've agreed with the Health Secretary that this will be reviewed weekly. And I will certainly be pressing for the removal of these restrictions at the earliest opportunity. What this is being done for, though, is, let's just keep this in mind, is accepting this now so that we don't have to face a much tougher lockdown later down the line as a result of a failure to act. Okay. And that is the prize that we're after here, Julia. We do not want a local lockdown in Greater Manchester. This is a modest change that we're asking for from people now to prevent something much worse later down the line.